Hi everyone, this is Netizan. Welcome to my channel. Today I will do a review of what is risk adjustment coding, and my subtitle is Understanding How Diagnosis Data Shapes Risk Score and Reimbursement. What is risk adjustment? Risk adjustment coding is a structured coding model used to capture clinical significant conditions, reflect patient complexity, predict future healthcare needs, and support accurate risk-based reimbursement. What is HCC? HCC represents clinical significant diagnosis organized into categories that support risk adjustment modeling. They capture and reflect patient complexity. They help predict future healthcare costs. They support accurate risk-based reimbursement. Clinically significant condition that maps to HCC. Many HCC mapped conditions required ongoing monitoring or treatment, and certain acute or severe conditions may also fall into HCC categories. Examples including chronic conditions, congestive heart failure CHF, COPD, chronic kidney disease, diabetes with complications, and various cancer. What is RAF score? A RAF equals risk adjustment factor. The RAF score is a numerical value that represents the patient's overall health risk. It estimates the patient expected healthcare costs compared to an average patient. A RAF of 1.0 equals the average risk. Score greater than 1.0 indicate higher expected costs. Score less than 1.0 indicate lower expected costs. What drives RAF score? Demographic, age, sex, Medicaid, dual eligibility status and living situation, clinical conditions, condition interaction. How the RAF score is calculated. Start with a demographic baseline based on age, sex, eligibility, and living setting. Add the weights for all qualifying HCC, clinically significant, properly documented diagnosis. Add any interaction factors for specific high-risk combinations of condition. Apply a normalization factor so payments remain budget neutral across the program. Why accurate documentation matters. The RAF scores reflect only what is documented and coded, resulting in a higher and more precise RAF score that reflects the patient's true level of risk. Missing, vague, or outdated diagnosis can understate patient risk and reduce reimbursement. Document must clearly support what the provider assessed, evaluates, or addressed during the encounter, existence of condition, evidence of ongoing monitoring, treatment, or management. What is the meet criteria? Meet helps validate that a documented condition is real, assessed, and actively managed. M. Monitor. Observing, tracking, or reviewing the condition, for example, labs, symptoms, vital, disease progress. E. Evaluate. Provider assess or interpretation, example, reviewing test results, assessing response to treatment, discussing severity. A. Assess or address. making clinical decision or addressing the condition. Example, adjusting medication, counseling, ordering tests. T, treatment, providing treatment or management. Example, prescription, medication, performing procedures, initiate therapy. What is annual HCC recapture? Recapture is the yearly process of redocumenting all active, chronic, and clinically significant conditions. HCC reset every calendar year. Each condition must be readdressed, redocumented, and recorded to be included in the current year's RAF calculation. Here's a few key points. HCC do not carry over year to year. They must be captured again annually. Chronic conditions must be confirmed as still active and affecting care, treatment, or monitoring. Accurate recapture ensures the RAF score reflects the patient's true risk and supports appropriate reimbursement. Missed recapture leads to loss of HCCs, lower RAF score, and underestimation of patient complexity. The purpose of recapture ensures complete and compliant documentation of all relevant conditions, supports accurate risk adjustment for Medicare Advantage and value-based programs, helps providers and plans align resources with actual patient needs, reassesses equal redocumentation, equal recapture, equal recode, equal accurate RAF score. Common HCC coding misconceptions. Not every diagnosis maps to an HCC. Medication alone do not validate a diagnosis. A problem list by itself may not support reportable coding. History of a condition does not always qualify for risk adjustment. Rule out, suspect, and probably conditions are not coded as confirmed diagnosis in an outpatient setting. Acute conditions only affect risk adjustment when they map to an HCC category and meet documentation requirements. Here's your key takeaway. Only diagnoses that map to an HCC impact risk adjustment. Documentation must support and validate each reported condition. Accurate HCC coding reflects the patient's true clinical complexity. Not every diagnosis qualifies for an HCC. Meet supporting documentation is essential for compliant coding. Accurate documentation supports compliant coding, appropriate reimbursement, and better patient care.